I know it can be hard to find out where the pain is coming from and what it means when your shoulder hurts. In this video, I'm going to break down everything you need to know about rotator cuff tendinopathy and what causes it. Hi, my name is Dr. Joseph Rosie. I'm a licensed physical therapist and owner of a Linear Performance. Now, I work with people dealing with all sorts of shoulder issues all day long. And in this video, we're going to talk about rotator cuff tendinopathy. Now, this is going to be a multiple video series, so make sure you subscribe to the channel so you don't miss the next videos. Now, the first thing I want to say is this isn't something that will just go away by itself or get better over time without treatment. You may go through some phases where it feels a little better, but it's generally followed up by another bout of discomfort and pain until the root of the problem is actually addressed. Now, it's important for you to know what that problem is and address it early so you can prevent further damage and get back to living your life. So first thing first, what exactly is rotator cuff tendinopathy? Rotator cuff tendinopathy is a type of condition where one or more of the rotator cuff muscles and tendons become irritated. We used to call this tendinitis or tendinosis, but now we call it tendinopathy because it better describes how healthy the tendon is along a spectrum, with normal healthy tendon being right here in the middle, where you have thinning of the tendon known as stress-shielded tendon on one side of the spectrum and a thickening of the tendon on the other side. Now, in order to move from one stage to another, it's truly dependent on how the tendon is stressed or loaded. Now, let's start with thinning of the tendon over here. Now, this occurs when the tendon is chronically underloaded and not being used much, causing the tendon to thin out. It really follows that principle of if you don't use it, you lose it. Now, in order to get to the stage, you would have to have some inactivity for some time. And I don't mean taking a week off. The people most susceptible to be in this stage are the ones that aren't what you would consider active. The tricky part is a lot more people fall into this stage than really care to admit. So think of your average young adult who used to be very active and no longer participates in sports, or a young professional who just got a new job or promotion, doesn't hit the gym as much anymore, or even the new parent who can't find time to do much else besides care for their newborn. These are the people with whom, when they chat with me, they tend to say that they are pretty active, but I come to find out that they really haven't been consistent for an extended period of time. Now, being in this stage alone doesn't cause pain. It's when they start to do more than what they are used to and accustomed to where the tendon starts to get irritated. Now, this can be doing even a normal amount of activity, but because you haven't been doing that much, you've been doing much less than normal up to this point, your baseline has changed, and what was once no big deal is now a lot more than what your body's accustomed to. So that's really this side of the spectrum, where we have a thinner, deconditioned tendon. Now, on the contrary, if a tendon is normal and healthy and becomes overloaded, it can become irritated and reactive, typically resulting in pain. This is your person that is not getting enough recovery and excessively overloading, or someone who is doing a lot more of high repetition movements with work, for example. Now, a lot of people who have a hard time with this, they misunderstand overloading. You have to overload yourself with exercise to make any changes or improvements. And the person that is in this position is not usually overloading at the gym too much per se. They are more so not giving the body the time and recovery in between sessions. The recovery time is when the tissue is actually repairing itself and getting stronger from the stimulus placed upon it with exercise. Because when we exercise, we are really just training to put a stimulus through our bodies. So when a tissue continues to stay in a reactive state for a prolonged period of time, on this end of the spectrum, it begins to thicken. Now, we don't want a thickened or a thinner tendon. What we want is a stronger tendon, and when a tendon is strong, it stiffens rather than gets thicker, as you would say right here in the middle of the spectrum. If it is thickening due to excess stress or activity and continues to thicken, it will go into what is called a tendon disrepair, which is when it really becomes a chronic injury. Now, it's in this stage that the fibers along the tendon start to become disorganized, which ultimately lead to degeneration. Now, regardless of what stage of the rotator cuff tendon is in, it can go back to this normal healthy tendon by giving it exactly what it needs. The rotator cuff is very susceptible to this because of how much we use our hands and arms. Think of a swimmer, a construction worker, painter, or anyone who's really using their arms for an extended period of time. On the other hand, some people are more sedentary than others and have an acute state of this is where they do a lot more than what their body's accustomed to. So think like packing up and moving a house, picking up a new racket sport, or even recovering from a rotator cuff surgery who didn't start therapy immediately and kept their arm in a sling for about 8 weeks. So rotator cuff tendinopathy usually happens gradually. You tend to feel stiff before you start to feel any pain. Most people think it's just part of getting older or sleeping on their shoulder wrong. But as it progresses, a lot of patients tend to have more pain at night or after activity. Now this is due to the chemical changes happening from the activity that is irritating the tissue and the buildup of these chemicals at night. But the pain is most often felt along the top of the shoulder here, where the tendons attach and can radiate down the arm. Now radiating pain can happen for a few different reasons. Number one, there can be enough inflammation at the shoulder causing irritation but not damage to the nerves at the shoulder that is producing pain down the arm. Number two, tendons are connected to the muscles that when irritated or have trigger points can have referred pain patterns that can radiate down the arm. And number three, there may actually be nerve pain coming from the neck. Now, at this point, some will notice that their shoulder is feeling warmer to touch or even, report having some swelling around the joint, possibly even causing some clicking and popping sensations. Now, patients, they tend to report pain during the night that may even wake them up from sleeping, especially if you're sleeping on that arm. Now, for more information on finding the best sleeping positions when dealing with shoulder pain so that you can get some good night's sleep, check out this other video that I already put together. So, now that we know what rotator cuff tendinopathy is, stay tuned for the next video as we delve deeper into the symptoms and what you can do to fix it. Thanks so much for watching, and I'll see you in the next video.